1 week out from your first surgery. And how was your recovery overall?
It was real good.
I
feel real good. No pain.
When were you able to get back to your normal activities?
I went back Monday.
So we did the procedure on Saturday. You were pretty much back by Monday morning. And what about pain control? Did you have to use a lot of pain pills, or?
I only took one in Sunday, one pain pill.
The rest just got by with just maybe the ibuprofen or Tylenol?
I took a couple Tylenols Monday and Tuesday and
Great, great. So this is really the exciting part during this. You were about 1 week out from your first stage. We're ready to do your second stage today, your outer thighs, to complete the process that with your first stage, you should have already seen a nice result at the very beginning within that first 24 hours. And now you should be starting to actually swell just a little bit. So the area should be maybe getting a little bit bigger.
Yeah, I see real nice results.
Okay. So you see results already?
Yeah.
Okay.
Nice results.
Great. All right, well, let's get you up and we'll take a look.
Yeah.
And the first thing I look for at the 1 week follow-up appointment is I usually just see people back to look at their incision sites to make sure that there's no signs of infections. And as you can see, the incision sites are barely noticeable at even 1 week post-operatively. You're going to heal very, very well, Yolanda.
Keep in mind, this is only the very beginning of the stage of healing. At this stage of 1 week, you're actually only probably about 30 to 40% of the way there. So you're going to get a lot better even from this point. The true healing with liposuction takes place from about 1 to 2 weeks to 2.5 to 3 months. So starting next week, every single day, you're going to get smaller and smaller. Things are going to shrink in more and more. Okay? So we're back to do your second stage now, the outer thighs. The reason that we didn't do it at the same time, if you recall, is because we always like to observe safety first in our clinic. We've never had a complication in surgery with liposuction because we really try to use a minimal amount of anesthesia, really low limits of local anesthesia. So it's better to stage things out and break them into 1 or 2 stages rather than try to do too much on one given day. All right? All right, let's have you turn around. So the areas, now that we have your waistline a lot more shrunk in, now this area is kind of a little bit more prominent. So we'll take care of this today. And this area is called your outer thigh or your saddlebag. We'll put a little incision right here, put a little incision right here, and a little one right here. All right, we're ready to go. Okay, the first step now that we're ready to begin is I'm going to make my 3 little incision sites. So in this syringe is just a little bit of local anesthesia. So just a little poke underneath the skin to numb the skin up. We'll numb it right here as well. You don't feel much of that? No. And then a final one right here. And then this is what I'm going to make my incision sites with. We don't use any scalpels or any real sharp instruments. Now that the skin is numb in those places, this is just a little dermatology punch biopsy. And we punch that right through the skin. Now that we have our incision sites, the second step in the procedure is to totally numb the areas with local anesthesia. The local anesthesia that we use is not only local anesthesia. It has another key ingredient in there called epinephrine or adrenaline. So there's 2 functions to the fluid that I'm going to put into your body right now. The number 1 function is to, as we spoke about, anesthetize or numb up the areas. The other function of the anesthesia is to shut down or constrict those blood vessels. So as I'm doing this, we're going to see the skin turn a little bit white. That means that it's doing its job. It's really effectively shutting down the blood supply so that when we go in later and suction out the fat, there's hardly any blood loss during the procedure. Okay? All right, so turn my anesthesia on, please. And you won't feel much of this at all, Yolanda. You remember from your previous procedure a week ago, you did wonderful, and you really didn't feel much of that at all either. So now, Yolanda, let's get the wedge in. We're ready to start suctioning.
these areas should be very, very numb from that local anesthesia. How are you feeling?
Good.
Okay. So you remember this part from last week. It's pretty
Yeah.
simple. It should only take about maybe 15-20 minutes for each thigh. But again, I want to point out the fact that we use very small instruments. This one happens to be about 2.7 millimeters in diameter. And the other cannula, if you could hand me that please, Jody, that we use is even smaller. And the reason we use these really small instruments is so that we really ensure that we get precision work in our clients, so that the cannulas don't leave behind any irregularities or waviness or track marks, okay? We really want to avoid giving someone anything that looks like a cellulite appearance. And by using small instruments, we really stay away from those pitfalls. This solution, it makes sure that you don't have any substantial blood loss whatsoever. We call it pure liquid gold. Keeping the blood loss to an absolute minimum is a really important thing with this procedure because it's, number one, it makes it very safe, so you don't get any trouble with blood loss. It's almost unheard of with the two-method technique to have any substantial blood loss. But the other thing that's very important about minimizing your blood loss and really watching that in patients is because it ensures that you're going to have that quick recovery. Remember, bruising is bleeding underneath the skin. And if we minimize blood loss, there's going to be a minimal amount of postoperative bruising and hence minimal amount of postoperative swelling. All of those things lead to a very quick recovery and really reduce your postoperative pain as well. So, Yolanda, how are you doing?
Real good.
We're almost done. We don't have a lot longer to go, maybe a couple hundred cc's, but yeah, I think I told you last time that this part of the procedure, these outer thighs, are even easier than when we did the area up above. So I've switched to even a smaller instrument now, just kind of feathering in the areas, making sure that we don't have any irregularities. One of the big advantages of having you awake like this is that you have muscle tone. So I can feel your muscle under there. I can feel the demarcation between muscle and fat. Etch the fat right off the top of the muscle, which gives me a much more thorough result. When someone's asleep under general anesthesia or IV sedation, then there's really no cooperation with the patient. And you'll see in a few minutes how come it becomes even more important that you're awake, because I'll actually stand you up and we'll take a look at the areas. And then if I have to do any fine-tuning while you're standing up, we can do it. We lose those advantages when you're asleep or under general or again, some type of sedation. We do the outer thigh actually includes doing part of the outer buttocks because the thigh is continuous to the buttocks. So it's a question I get asked quite often about, do I need to do my buttocks? Well, when we do the outer thigh, we always end up doing a good portion of the buttocks so that they all blend together. The outer thighs are probably the most important part for us to really get a good look at in a standing position so that we can fine-tune them. To do things when you're just totally on the table and get it perfect is very, very difficult because we have two outer thighs. We need to get symmetry between one to the other. So we're going to stand you up here, and we may end up doing a little bit more suctioning, but at least I want to take a look, okay? Are you doing okay? Are you comfortable?
Yeah, I'm very comfortable. Okay.
All right, we're all done.
Good.
I'm excited for you.
I'm very excited too.
So we're going to leave the nurses alone. We're going to get you all bundled up back in your garment again, and I'm going to see you back in one more week.
Okay.